Hi everyone, welcome to our second Grounded Dialogue. We are Rejuvenate, we are a research and action hub, and we are concerned with participation, child and youth rights and social justice. I'm just going to introduce Rejuvenate and the dialogue series broadly, and then I'm going to hand over to Vicky, who's going to actually no, I'm not, sorry, I'm going to hand over to Mariah who's going to do a bit of housekeeping, and then hand over to Vicky, who's going to talk specifically about today's dialogue. So we are running a series of 6 dialogues. We had the first one last year in September, which was about our Rejuvenate principles. The next one is on creative praxis. I'm really excited about it. I'll talk a bit more about who's going to be talking at that later. And we've got some fantastic facilitators. Thank you very much for coming today. Koki, Rashmi, Raisa, and Mariah and myself will step in if needed as well. And yeah, without further ado, Mariah, do you want to do some housekeeping?
Yes. Hi, everyone. Thank you very much. You have probably gotten an email from me or multiple emails from me. So just a big thank you for being here today. Really looking forward to all the discussions and sharing of everyone's experiences. Just some housekeeping. We'd love to see your faces if your connection allows. It helps us to feel like we're not just talking to a screen. So if possible, we'd love to see you. Microphone. To keep background noise to a minimum, we'd really appreciate you keeping your microphone on mute, unless, of course, you are speaking. Please use the Zoom chat box. You can put questions in the chat box. You can put comments. This is a great way to kind of keep the conversation flowing, so we encourage that you use it. We will have breakout sessions. These are about 20 minutes long. And we really encourage everyone to speak in the breakout sessions. There'll be small groups. The sessions won't be recorded, so it would be great to hear from you. And this helps us kind of build the knowledge and contribute to the experiences of the event. And as Tessa said, there will be breakout room facilitators, and they should be able to answer any questions you have. And they'll kind of be taking notes and giving a feedback of the breakout sessions at the end. But that's all for housekeeping. I have my email on here and Alice's email. So if you do encounter any technical difficulties during the event, please email one of us, and we may not respond to you immediately, but we'll respond to you as soon as we see your message and try and help you sort them out. So without further ado, I'm going to pass to my colleague, Vicky, who is going to introduce the event and our first speakers.
Hi, good morning, good afternoon to some of you. Thank you very much for joining us. We're quite excited to have this dialogue because we have all been experiencing the COVID-19 pandemic. And we have all experienced it in very different ways. We've all been learning, we've been facing many challenges personally and in our research work and implementation with children and young people. And we want to share a little bit about that. Now, in this dialogue, this is a series, one of a series of 6, and we had the last one in 2021 and kicked it all off to look at the COVID, to look at child-centered principles in research and implementation. And we decided in this dialogue to turn it all upside down. So we had to have a lot of input from all of you to start with, after our fantastic youth keynote speaker and her team. And then we have provocateurs at the end who are going to tell us about their work, and we're really pleased to have Theron and Hilde Deman here, and I will introduce them later, to reflect on some of the experiences that you have had. So this is very much a space for sharing our experiences. And just to kick us off, just to share the very different experiences that I've had in working on a GCLF funded project with Pendekezo Letu in Kenya with street connected children, and in Scotland across the Highlands and Islands on a Scottish Funding Council programme of research. There were many unexpected challenges, and I think one theme which might have come through for me is flexibility and dealing with these very unexpected challenges of different restrictions and different ways of working. For example, in Scotland, instead of going back to going through with all our plans for creative visual research, we actually had to start off with very traditional phone calls and try to work things out as we went along. In Kenya, I obviously wasn't able to travel at all, so that trust in partnership, I think that came through very strongly for me as well. The issue of absolutely needing to work with other people to even access children and young people during this period of time. So in Scotland, we relied on working with teachers who were in contact with children and young people, and in Kenya with social workers. The issue of capacity building and working with partners as researchers, and the different ways in which we've all communicated. Part of this today is to reflect on your experiences, the challenges, but also some of the positive things which have come out of this. We have new and shifting norms of working. Maybe some will stay, maybe we will leave some behind. I love to meet people face to face, but actually, instead of having a seminar for Rejuvenate, we're having these 6 dialogues, and we're finding the inclusion of youth speakers and the interaction with people in different global contexts is so much better actually than everyone having to travel to one place. So there are some positives that we may stick with, and there are some new things which we've all been having to do, being online all the time, that we may want to get rid of. So let's think about how the ways in which we're working have been challenging, but some have been positive. Perhaps the power dynamics around us and in the context in which we're working, have people actually listened to children and young people more, or have they been rather forgotten? So certainly in our work with adults and children across Scotland, we certainly found that children and young people in the policies and the attention given during the pandemic, a lot of issues of children and young people are only now emerging. So with that, I have great pleasure in welcoming, first of all, to kick us off before the working group, the CLARISSA programme of research and our youth keynote speaker, Subekhchhya Buda Magar. And has Subekhchhya been able to join us yet? Are you here?
Yes, she has joined us.
Fantastic. Namaste. I'm so pleased that you are here. And I'm now going to hand over to you, your team, for the next 10 minutes. Thank you.
Morning, everyone. Thank you for being here. And it's such a pleasure for me to present in front of you all. Today, I'm going to literate you about my experience on life story collection. First of all, let me introduce myself. I'm Subekhchhya Buda Magar. I used to work as waiter in Party Palace at the age of only 14. I was a part of story collection as storyteller and story collector for CLARISSA program. अर्को, sir. Talking about my experience of working in CLARISSA, I still remember the first day how I came here to tell about my story for CLARISSA. At first, I was a bit nervous, but then after observing the environment, I felt comfortable to talk about my experience of working in WFCL, which is worst form of child labor. Likewise, CLARISSA collected the total number of 400 life stories of children working in WFCL, out of which 50 life stories were collected by children themselves. Whereas CLARISSA invited me to be the part of child lead life story collection process as story collector. And also training was provided by CLARISSA that helped me to clearly understand the life story collection. The changes in me after being the part of life story collection was collecting life stories of my peers working in WFCL taught me that we should never judge. We need a lot of passion in life and should never judge anyone by their jobs. Life story collection process improved my Nepali writing skills as well. I became more confident and positive about myself too. And I no longer feel embarrassed to talk about my past jobs because it was what situation made me do, and that is how I started accepting that it was just the time, the phase of my life. Arko. My experience of working in COVID-19 was a bit difficult because infected people were gradually increasing day by day in Nepal, and I was reluctant to go out. I was mentally disturbed as my family was having financial crisis. Since suicide cases were also increasing in Nepal, that made me more disturbed. But however, during our story collection, we maintained social distances and used hand sanitizer, masks to keep ourselves protected by and collect the stories. The motivations that I've got after getting involved in this project was I feel that being a part of CLARISSA has been an investment to my future. Engaging in the life story collection process despite all the challenges due to COVID-19 gave me sense of satisfaction.
Thank you so much. I think we'll pass to the CLARISSA team. Thank you so much for sharing your experiences.
So thank you, Maria. Like, I'm Sudhir Malla and I am the content coordinator for CLARISSA Nepal. So Subekhchhya is one of our youth researcher who is involved as a storyteller. Then she further trained to a story collector. Now she's also working as a young researcher in our upcoming intervention. So basically, I just want to open this forum if you have any questions regarding this or for any clarity, maybe a couple of minutes you can ask questions, and my colleagues Pragya, Susmita, and Subekhchhya, myself, we can answer it. Thank you.
That's lovely. And maybe Sbe, you could just tell people what CLARISSA stands for and just 1 minute about what you're trying to do in the overall project. That would be fantastic. I know you're working also across with colleagues in Bangladesh.
Yeah, CLARISSA is a child labor, like a child-led action research innovation programs in South Asia and Southeast Asia, and just started this program in Bangladesh, Nepal, and Myanmar, and in particularly in Nepal, we are working with those children who are in worst form of child labor, particularly in adult entertainment sector. So basically, those children who are involved in this entertainment sector, like for example, like dance and this dohoris is called, and some other entertainment form where is mostly operate in the late night till early in the morning. So there are childrens are involved in this particular business. So it is a more like a very urban and peri-urban centric kind of a business. So lots of young families, those migrated after a kind of a internal conflict that we had last 10 years. So lots of young people, they go there for a kind of a job placement, but at the same time they've been physically abused and other kind of a malpractices happen over there. So basically we want to do research plus action so that we can work together with the supply side and the demand side for this program. So basically our core program is to working with the young people and children, so that from their own life stories, why they landed into that, some cause and consequences triggering to that. So we want to have those evidences. Based on that, we want to intervene together with them. So basically, this is the whole kind of a concept behind the CLARISSA in Nepal. I guess, yeah, thank you.
Thanks. So do we have any questions from other participants in the dialogue? Do we have any of the other CLARISSA team members that want to talk about any of the ways in which you overcame the challenges in COVID? Maybe Shushmita or Kriti might want to talk to us about that.
Let me share some of the challenges. During the time of the story collection, we were in the COVID, so number of cases was rising. So the difficult part was that it was difficult to convince the children to come for the story collection. But then we made sure that all the safety and security measures are followed. And we had a couple of rapport building meetings with the children themselves. And we made sure that social distance is maintained, and we provided them with masks and sanitizer. And I think those were some of the challenges during the life story collection. And I would also agree to Vicky earlier when you said that, adaptation was also very key for us. We adapted in many ways. So I think one of the learning is also while working with the children is that we work with them rather than we saying that this is the way that we should be doing any kind of work. It is important that we ask them what are the options. So during the life story collection as well, we also made other adaptation that includes, for example, if we are calling them for the life story collection, we ask them what could be an appropriate venue for them, rather than we saying that, okay, you should come to the venue. We definitely earlier we felt that calling them to a venue would be some kind of risky as well. But then we also tried to go to the community as well, and we also asked for the options to make sure that children also feel very safe.
Thank you so much. And that is a wonderful start and a wonderful set of reflections. And thank you so much, Subekhchhya, as well, for sharing your experiences to kick us off, and the CLARISSA team, because we're all going to go into groups. So we've got about 20 minutes, and the CLARISSA team will also be spread across the groups. And we're going to really reflect on our own experiences. We have wonderful youth facilitators here who are young researchers, mainly coming through the IDS Gender and Development Masters programs, and thank you so much to them for joining us. And we're going to talk about experiences and also some of those shifting and new norms, both in the ways in which we do research and also in our context. So Alice, the wonderful Alice, is going to split us all up, and we have a nice 20 minutes. You will all be brought back into this room again, and your thoughts will be shared, but we will stop recording while you're in groups so that you have a very safe space to make connections and also to contribute your projects, your research, your interventions to our living archive as well. So please feel free to continue this conversation after the dialogue too. So Alice will now send us all into smaller groups so that everyone has more chance to speak. So thank you so much, namaste, and thank you, Dhanyabad. Alice, over to you to split us.
I'll open the rooms now.
Thank you. Are we all back in? I think we are, Alice. Yes? Fantastic. So I was so interested by all the conversation, I'm almost stunned. And we really encourage you to continue to give examples to the Living Archive. So I'm going to hand straight through to the facilitators to feedback for a couple of minutes on each one. So Rashmi, would you like to go first?
Sure, thank you so much, Vicky, and thank you to everyone in our group. It was really brilliant hearing all of your experiences. We had Ruth in our group, who's an ethnographic researcher. We had Vicky, who you know. We had Sudhir, who you heard from before on the CLARISSA program. We had Evie, who works in Indonesia on a Rumah Sokala. I hope I'm pronouncing that somewhat correctly, which is a homeschooling village scenario, which was really, really interesting to hear about as well. And then we also had Laura, who works at Care International on monitoring and evaluations, and has also managed to get young people involved in the actual practitioner level of evaluating programs for themselves and data collection. So a wide range, and some key points that came up. Well, access was huge. COVID has really, really impacted access, both really directly when it comes to education, highlighting serious class inequalities, where children without access to technology have not been able to gain access to education and other facilities like that, but also the major snowballing effects of financial inequalities and instability, and the impact that it's had on mental health as well for children. So the real question is making children and young people visible going forward when we're thinking about a new normal that can be possible in prioritizing child rights in a COVID-19 pandemic that will last for who knows how long. But I'll leave it at that. Thank you so much.
What a brilliant summary. Amazing. Raisa, would you like to go next, please?
It's always surprising how you think that 20 minutes is a lot of time, and it never is a lot of time. We had that critical, 59 seconds to go, and then the emergency linked to that. But anyway, so we had a really interesting group we had Sushmita and Maria both working in different parts of the country, the world with CLARISSA, and Maria also working with Rejuvenate. And then we had Henk, who works with Save the Children. We had Rachel and Dorte, both who I've had the privilege of knowing from IDS, and then of course Linda, who you'll hear from soon. And then it was such interesting observations where Sushmita was telling us about how she was collecting data and the challenges that came from how these children's lives itself were shaped, and the fact that COVID led to losing connections with them and trying to relocate them was a challenge. And similar observations about how structural challenges lead to really intensify within COVID, especially with more marginalized children from more marginalized groups, where if they are children with disabilities and so on and so forth. Specific observations also about how mental health of children are affected in this situation, and how much we expect from people who work within the community to provide for those mental health expectations. That was, I think, a really key observation. Similarly, there was something about how we need to look at, when we're linking people online, we need to look at how boys and girls are differently affected in terms of the fact that who has access. I mean, similar to what Rashmi was saying earlier, in terms of who has access, people from which communities, but also do more boys have access to phones as opposed to girls? But of course, everyone's similarly celebrating that opportunity for more people to be reached once everything's moved online, like Vicky was observing earlier. I don't know if I've missed out anything, but.
That is also fantastic and really interesting to see these strands and themes coming through. So thank you so much. And I'm going to hand over to Koki, please.
Thank you. I was in a group with Subekhchhya, I hope I'm saying your name right again, and Pragya, as well as Hilde, who works in peacebuilding. We'll be hearing from her shortly. And I also was in a group with Tessa, who is a lecturer and of course part of Rejuvenate. I think the key thing that came out really amongst a lot of things is children's mental health. And that was a point that was raised by Pragya, who was saying that's what she found in her work working with CLARISSA, is that mental health is at the forefront now, and we're finally paying attention to it, but we need to do so more for children. And she had hoped that that's something we could focus on moving forward as the pandemic sort of hopefully goes away. Another point that was made by Hilde was that there is a distrust between young people and the government, and that this was probably evident even before COVID pandemic started. And you see it, coming up with vaccine distrust, but at the core and base of that distrust is because people just generally do not trust governments, and in particular young people. And I think that tied in quite nicely with what Tessa's shared on adultism, and how there's just a disconnect between the older generation and young people, and how the older generation at times may not respect the potential and the views and the thoughts that come from young people, and how that also plays out vice versa with young people not really trusting the adults. And another key point that was mentioned, I think I mentioned everybody actually. Yeah, I think that's in a nutshell what everybody had to say in my group. I hope I didn't leave anything out. Thank you.
Fantastic, really interesting, and also coming through from our last dialogue, that issue of government, young people, and whether government also trust young people or not. So really, really interesting. And this theme of adultism, which is coming through all of our dialogues now, about the disrespect in many ways of the thoughts and views of young people in our society. So very interesting themes coming out here. I'm going to introduce our provocateurs, who are going to, first of all, tell us a little bit about their own work, and then their reflections on the group discussions and some of the themes that we've got coming through. We've got Linda Theron first, and then Hilde Deman. I'm going to introduce Linda first of all, and we'll have a chance for questions at the end of her talk. She's a professor at the Department of Educational Psychology at the Faculty of Education in the University of Pretoria, and Linda's going to tell us a little bit more about her work and then her reflections on some of these themes. Thank you, Linda. Over to you.
Thanks so much, Vicky, and good afternoon to everybody, and thank you for this lovely invitation. Mariah, I'm trying to share my screen, but it says that it's been disabled. Host disabled participant screen sharing. Is there any way you can enable it?
I've just made you co-host, so hopefully that will facilitate. Sorry.
It does. Thank you so much. Let me see. And I'm hoping
that works.
you all see a slide that says RISE, which is what I'd like to talk to you all about this afternoon, just briefly. And RISE is a resilience study that I'm currently involved in. It's an acronym for Resilient Youth in Stressed Environments. And it started pre-pandemic and it is ongoing. We're in our final year of the study. And so I think it really provides useful insights into both the research that I'm doing and how we had to adapt what we had planned and been funded for when COVID just took over our lives. So to help you understand a little bit about the background of the RISE study, let me say that the original RISE study had sites in Canada and in South Africa. And since then, we've extended those sites to include sites in Russia. I'm only going to speak to you about one of the South African sites this afternoon, and that's the Secunda Mbalenhle site. And that site is a site that is extremely stressed. All our sites in Canada, in South Africa, and in Russia are sites that are stressed, mostly for economic reasons, but there are additional reasons. And so as I'm hoping you can see on the slide, which is showing you typical conditions in the community of Mbalenhle, where the majority of our participants came from, I'm hoping you can see that this community is a physically stressed community. There's lots of pollution. In fact, there are toxic levels of pollution. But in addition to those toxic levels of pollution, as you can see on the top of my slide, there are very, very few services that actually work as they should. And so electricity is not reliable, refuse removal is not reliable, sanitation is not reliable, and so on and so on. And this adds to life being really stressful for young people who grow up in this community. In addition to those physical stresses, this community is economically stressed. There are really rampant levels of poverty, extreme poverty. And then it's a socially stressed community too, because there's lots of violence, as we often find in communities that have a migrant population. This community does have a migrant population because it is adjacent to a huge petrochemical industry that attracts lots of people who are so hopeful to get work. And of course, that doesn't always materialize. And so there are lots of conflicts within the community itself. And so in this stressed community, we thought that it would be a really, really good prototype for trying to understand the resilience of young people. Because the studies that we've done for many years show us that when young people grow up in a community as stressed as this one, then they have a very high probability of being vulnerable and of showing negative life outcomes. But what we're learning from the young people in this community and in other communities is that's not necessarily the case. And so what we are interested in the RISE study is to understand what is it that supports the capacity of some young people in this community to do well in life, to function successfully, to develop successfully, to remain engaged in school, to be civically engaged in positive ways, even though they live in this really, really challenging community. And so what we thought we needed to do, in addition to better understanding their resilience, is that we need to challenge some of the problems in the resilience research that has been done worldwide. Resilience is a very popular research topic, as I'm sure many of you will know, but there are 3 problems with resilience research, and I'm hoping I'll provoke you to think a little bit about this. Firstly, the majority of resilience research takes place in minority world contexts. So young people, like the majority of the young people in my country, are typically invisible in the resilience studies that have been published. Secondly, most of the studies that are published on resilience emphasize that resilience, or this capacity to do well in life, even when life is challenging, is about a psychological ruggedness. Now, I'm a psychologist by training, so I buy into the psychological ruggedness, but we're learning that that's not enough. It's only part of what enables young people's resilience. And then thirdly, and really worryingly, most of the landmark studies have been informed, designed by adults. And so it's very seldom that we hear from young people themselves what supports their resilience. And so to challenge this, we conceptualized this RISE study which looked beyond the psychological. We tried to understand from young people what they felt enabled their resilience in the built environment, what was supportive. Biologically, we took hair samples to look at what was going on under the skin, get at their cortisol levels to better understand what from the biological system was supporting their resilience. We worked with them to understand their natural environment and what natural resources were helpful. And we did the same with the social system and the psychological system. And I think this is pre-COVID, right? And pre-COVID, we established a youth advisory committee, young people who lived in this community. You're seeing some of them on the slide. There are these wonderfully engaging young people who were really brilliant champions for resilience research. They guided our research. They helped us to tweak what we thought would be ways of getting at all those systemic levels to go beyond psychological understandings. And you can imagine for the psychological and the social and even the natural environment and built environment resources, we did gorgeous participatory work. And this youth advisory panel helped us to recruit around 600 young people from the community, and they were hands-on active. And then bang, COVID happened. And so I think we were 4 years into the study when COVID happened, and we still had to do our final ×3 data collection, quantitative, qualitative, hair sampling. And our ethics committee said, close down. And I'm sure many of you had that experience around the world. There was just too much danger of young people's health being affected, of reputational damage. And so they said, close down. And we had to find really innovative ways to not close down the study, because that's something that I want to claim this afternoon, and that I really want to provoke us all to agree with, that we can't close down research during pandemics, because young people's voices matter. And we have to learn from them, particularly in the context of resilience. And so I'll just briefly say that we redesigned part of the study. We continued with the hair sampling. We got young people to identify a household member that they trusted. And we then trained the household members telephonically to take a hair sample, and they sent it to us, or we left it at a collection point. We changed our in-person qualitative work to traditional telephonic interviews, but we also added digital diaries. We provided young people with data, and we invited them to tell us 2 to 3 times a week what was going on in their life, what was stressful, and how were they managing those stresses, and what might that teach us about their resilience. So Vicky asked that I please leave time for some questions. So let me just briefly say that the biggest challenge of changing our design and including telephonic and digital diary methods was that there's very little reliable electricity, as I said earlier, and young people didn't always have the data that they needed to participate. So we had to fund the data, and we had to have really flexible, competent young researchers who were willing to say, okay, if you can't have the telephonic interview with me at the time we arranged, no problem, I get it. When will it suit you? If telephones died in the middle of an interview, it was a case of following up later and continuing the interview. So we had these competent, flexible young researchers who were working with our young people in the community. And what I want you to know, the beauty of this was that we learned really rich, provocative, or we gained really rich, provocative insights into the resilience of young people and how it needs to be multi-systemic. And so it really, really mandates a social justice imperative, also in COVID times, for resilience work and for resilience work, including young people. And then a completely serendipitous finding. We trained the young researchers who were working with us in this project to be able to support young people who became quite distressed during the calls to access on telephonic mental health support services. And this wasn't part of what we were researching, but I can't tell you the number of transcripts in which young people would say, thank you so much for telling me about, and then they would mention whichever telephonic mental health service it was. I never thought that there was something like that, and I've benefited from speaking to them. So bottom line, what would I like to leave you with? I'd like to leave you with a statement that in COVID times, as in any other challenging times, we have a moral imperative to design research and redesign research in ways that sustains the involvement, the active involvement of young people as co-researchers and as participants. And I'll stop there. Vicky, I think I didn't leave time for questions. I apologize.
No, we're fine. We can take some questions. So if you stop sharing your screen and we can see, that's fantastic. Really, really interesting. And some really interesting challenges about the way we do research in an ethical way in our ethical committees, and actually then being closed down and finding ways around. Really interesting there. How flexible young people have been. Incredible. Absolutely incredible. I'd love to take some questions, please. Young facilitators, speakers, please also ask questions. People from the Rejuvenate team. This is really, really rich and wonderful input. Thank you so much. So can you just either, I'm having trouble seeing everyone, so if you can either put your hand up.
Tessa, I can help you.
On the screen.
I mean, sorry, Tessa. Vicky, I can help you with managing questions. I can see everyone on the screen.
Yeah. Okay, so anyone who'd like to ask a question, please. I've got Shashmita. Thanks. And then Tessa.
Thanks, Vicky. So I just have one question. I was just curious about knowing, like, talking about the youth committee that you talked, Linda. So like, was there any challenge to retain those members? Because while working with children, there is like high chances of dropouts. So did you guys experience, had some like kind of experiences or challenges related to that?
Great questions, Sushmita. Thank you for that. No, we didn't have challenges with the youth committee, but we'd been working with them for 3.5 to 4 years prior to COVID. So we had regular interaction with them, and alternate telephone numbers of people they trusted in case we could no longer reach them. And because they are quite a close-knit group, they've become a really close-knit group. If we couldn't find one of them, we would say to the others, what's happened to? And they would go, oh, he's on holiday. He's gone to his gran. He'll be back. Or, oh no, he's lost his phone. Or he couldn't afford that contract anymore, use this number. So the social connectedness in the group of youth advisors was really helpful, but we did struggle hugely to contact our 600 participants that had participated in time 1. Again, it's time 3. That was, we didn't manage to contact more than just over 50% of them. That's how many contact details had changed, or they were no longer contactable. And we do think it relates largely to the migrant characteristics of this population in this community, but also COVID, where people just couldn't afford to remain connected.
Brilliant. I'm going to take one more question from Tessa, and then we're going to go on to Hilde, but do save your questions. We have a few minutes at the end as well. Tessa?
Hi, thanks very much, Linda. That was really, really interesting. This is slightly ill-formed, so forgive me, but I am very interested to know whether you have any anecdotal or other evidence around the impact of your engagement with young people on other generations with whom they interact. So I'm really fascinated by, and it's partly about being middle-aged, I think, that I have kind of young adults and young children, and then also older parents in my life that have been very badly affected by COVID. And I'm really fascinated by how tackling adultism might engender kind of more intergenerational respect more broadly, and might benefit older generations. And I know in South Africa that interpolates in a particular way, right? Because a lot of children are looked after by their grandparents. And I was just wondering if you had any thoughts on that, and maybe it's too early to stay in your study, but.
Tessa, I don't have thoughts about that specific to COVID, because pre-COVID, so many of the young people that we worked with were living in intergenerational families. What I can add is that lots of the angst that they reported, lots of the distress that they reported, particularly at the start of COVID, related to fears for their elderly relatives becoming ill and passing on. And so that's where the mental health supports were really key. The fact that they could phone somebody who wouldn't judge them for those fears and that they could just talk to. But I don't see evidence, not anecdotally or in the data that we are busy analyzing, that COVID in any way caused a decline in the cohesiveness. In fact, we're seeing the opposite. We're seeing that what was really key to these young people's resilience, particularly during COVID, was their informal support networks, family and neighbors. And that just increased. And it relates to the context of the study, the fact that there are so few formal services.
Yeah, interesting. Thank you very much.
Thank you so much. And that's an interesting thought to bear in mind for other people in case studies about that intergenerational kind of cohesion or actually sometimes breakdown, which I think is sometimes seen, and we saw in some cases in our research. So thank you so much. That was really, really interesting. I'm going to pass on now to Hilde Deman, who is the Global Programme Manager for Search for Common Ground. And Hilde, I'm relying on you to introduce your work, and I'm going to turn my camera off and turn it back on when we are ready for questions. Thanks.
Thank you, Vicky, and thanks, everybody. I'll keep it brief, but maybe I'll just start by saying maybe just a few more words about Search for Common Ground. So Search for Common Ground is the largest dedicated peace-building organization in the world, and we're present in over 30 countries that are often in open conflict or that are in the phases just right after conflict and in reconstruction phases. And we've been in existence for about 40 years, and I would say we focused a lot in all of our work on promoting social cohesion at community level and at societal level. And so one major concern or point of interest for us when the pandemic started was how is the pandemic going to affect social cohesion? We have good experience in terms of promoting social cohesion among different groups that are in societies in conflict. And so our main concern throughout the pandemic was how can we avoid deterioration of cohesion in these countries that are already under, for many reasons, under heavy levels of stress and where there's pre-existing conflict existing. And so maybe I'll start just by saying a couple of examples of how, maybe just another key point about Search for Common Ground is that we have, since our creation, but especially in the last 10, 15 years, we've very much invested in terms of how do we involve and really put young people in the driving seats of our peace building efforts. And so we've done a lot of innovative programming around that across the world, but also at the more global policy level, we're doing a lot of work around that. So that's a bit where we come from. And I think when we started out in the pandemic, I think there's a number of ways in which we have seen young people step in and take on roles that we hadn't necessarily even ourselves envisioned before, but that for us were really key to support and amplify more. And I'll just give a couple of examples. Some of the interesting examples that we've seen when the pandemic broke out, I was still in Tunisia. I was our country director for Tunisia and Libya before, so I was in Tunis. And Tunisia historically is a place where there's a lot of tensions and conflict between youth and security forces. The police tends to be very violent towards young people. There's a lot of human rights violations. So there's a very high level of distrust between youth and security forces. But very interestingly, in those very first weeks of the pandemic, we actually saw Tunisia, like many other countries, went into a pretty heavy lockdown very soon on because the health implications were going to be so high. And then we actually saw young people stepping in ways that the adults weren't necessarily expecting. And that was also interesting in how that then shifted some of the ways that adults were perceiving young people's roles. And for example, in some of the smaller villages, it was the young people who were going around making sure that older people had the necessary food and items in the house. And they were themselves, the young people were themselves proactively reaching out, for example, to the police and security forces to make sure that they would get authorization to circulate, to distribute some of these goods to older people. So that was an interesting way that the pandemic actually provided an opportunity for young people to collaborate with security forces in ways that we hadn't otherwise seen before. So those were some positive examples. I think another interesting way that young people have acted is we see that young people, and we saw this even before COVID. We saw this during the Ebola outbreak in West Africa and DRC, where, as I was saying before in the group work, there's low levels of trust in the government and sometimes even in health workers, especially if those health workers come from different parts of the country. People don't tend to trust them. So what we've done in a lot of places is actually work with young people and have young people be among the key messengers around health measures, around respect for some of the lockdown measures that are in place, etc. So, and one of the examples that I remember, we work in Uganda in some of the refugee settlements, where the government of Uganda was doing quite a lot of public awareness raising early on around prevention measures, etc. But it was done in languages that the elderly population of the refugees wasn't understanding. So then it was actually the younger refugees who A, understood the languages and B, had access to online information. They were then translated that information for their grandparents, their uncles and aunties, etc. in the camps. There was another very interesting example, I thought, where we see young people playing that role. And another, just another example to cite is we've done for the first time in our COVID response programming now work with like a global group of influencers, social media influencers, TikTok, Instagram, Facebook, Twitter, etc., who tend to be obviously young people, but most of them are below 30, even below 25. Some of the people that we worked with already had quite a large following on their social media platforms. So for us, it was just a question of how do we amplify that and how can we support them and give them access to more resources, etc. And we've seen really interesting synergies take place. Like we, for example, had a young influencer from Nigeria work with a young influencer from Iraq, setting up some online campaigns on how to fight disinformation online. We had young women from Kenya doing online campaigns around increased risks of gender-based violence and how to respond to it. So that there's that level of social media influencing where young people just tend to be much more tech savvy than we are in general. And so in terms of the numbers of people that they can reach and the credibility that they have, those are great resources for us to tap into. And one of the things that we were even sometimes joking about among our teams is that there's a lot of work that's being done around media literacy for young people, etc. We actually found over the past year that young people tend to be among the more, they tend to be more critical about the information they find online. And they've actually have been confronted with adults, parents, grandparents who've actually sometimes been targeted by this information about the pandemic, and the young people being the one to then provide correct information to their parents, etc. So there's definitely a level of, I think we need to reframe a bit sometimes the conversation about disinformation and actually think about media literacy for adults and older populations, because I think the problem is not actually young people in many cases. So I do want to then also just raise a couple of, from the research that we've been doing. So we've been doing research on the impact of the pandemic on social cohesion in 6 countries: Uganda, Kenya, Nigeria, Tanzania, Yemen, and Palestine. So all very different settings. But we look, for example, at the ways that people perceive of their government's response. Do they feel that their government's response is treating everybody equally? Do they trust what the government is saying? Do they trust what the media is saying? And do they feel, there's questions around also horizontal cohesion. So how do they perceive of other groups, and how willing are they to collaborate with other groups in the pandemic response? And so some of the key issues that arise out of that research, and that are particularly in regards to young people, that I just quickly want to highlight, is we ask a question in all of the 6 countries around people's loss of livelihoods due to the pandemic, whether people have lost their main source of income, and those figures are really staggeringly high. And I speak up to 70% of respondents in some areas of Nigeria, up to 60% in places like Yemen or Palestine. Like it's not been below 45% anywhere where we ask this question. So these are very high levels of people facing direct economic impact of the pandemic. And in many cases, young people are being the ones hit first because of loss of employment, etc. And so the question that we are asking ourselves as peace builders is, what does that mean for a society's stability in the long term? What does that mean for people's resilience, as we talked about earlier? What does that mean for people's perspectives? And that's something that is something that we haven't come to terms with. I think it's something that we just need to be really aware about. The mental health impact, of course, has been cited many times, and in the group discussion that we had, the smaller group, there was also the interesting that like there could be an opportunity around COVID to actually make mental health less of a taboo issue, because it's such a big taboo issue in many places, and so the stigma around that. But that's definitely something I think that young people have been so impacted, and there's whole generations that have been impacted, and how will that play out in the long run? Education has been cited many times. Just to refer back to Uganda. Uganda just last week is restarting in-person education again after a 2-year shutdown of schools, which is a massive amount of time for young people. And it's been said by others on the call before, many of those young people have had absolutely no access to education at all, just because the digital divide is so big. So what does that mean? And then maybe just the last note to end on, I do think also the one thing that we're clearly seeing because of the pandemic are rising inequalities inside countries, but also between countries, whether we talk about the economic impact, whether we talk about access to vaccines, whether we talk about who gets to decide over access to those vaccines, etc. And again, like we've seen this from other type of epidemics and pandemics before, the way that rising inequality and lower economic development right after epidemics impact societies is very, very high. And so I do think COVID is here to stay, but I do think that we're going to have to start grappling with some of these longer term consequences also in the next couple of months and years. So I'll keep it to that, Vicky. Thanks.
Thank you so much, Hilde. They were really important global issues and issues of widening inequalities, social cohesion, education, mental health, really important, but also very, very inspiring, these new roles that young people are taking on and stepping into. And in a similar way to Linda's talk, you know, saying this flexibility, this capacity of young people to find solutions and be very positive in times of crisis. And so we've got just a few minutes for some questions. If I can open out to the floor, that would be great. Anyone who has some final questions? We're in the wrap-up session now. So anything which has struck you or that you would like to ask before we tie up? Just open your mics at this point, I think, if there are. Otherwise, we're coming to the end. Any last questions? No, so just to wrap up then, I want to very much thank everybody who's input to this discussion, and some of these very important themes which are coming through about how we access children and young people, and particularly the most marginalized, especially when we're considering the way in which we've needed to access people and who has mobile phones, who has that access to digital media and digital wave, actually just the money to pay for the technology and the data. We've seen the widening inequalities, the issues of mental health, education, the importance of ensuring that we keep visible children and young people's thoughts and ideas and solutions, and that they have, and we have evidence growing of this, taken on roles to really support other generations and to improve social cohesion, where sometimes there's been a mistrust and sometimes still is between government and young people. And within a context of adultism, actually young people are making very positive moves and taking on these active roles in rebuilding our societies. So I think this has been really inspirational in terms of the kinds of themes and discussions and the inputs which we've had today. And we will be producing from this a short record that we'll send to you all. And the recording will be also available online. And I want to thank everyone for their participation. And I'm going to hand over to Tessa as well to just talk about our next steps in Rejuvenate and the next dialogues as well. I want to thank the Rejuvenate team and all the facilitators as well, Alice and Mariah, for all their work on the website. Please do keep interacting with the website and the blogs that are going up, and also contribute your fantastic examples to the Living Archive. And Tessa, can I hand over to you for any other last steps?
Sure.
Next steps, not last steps.
So just to echo Vicky's thank you. Thanks so much. Thanks to our facilitators who are all talented researchers in their own right. Thanks to our provocateurs. Thank you, Clarissa team. And I just wanted to say the next dialogue is on the 23rd of February. We have 3 speakers. We have Veronica Yates from the Right Studio. Some of you may know her as the director of CRIN. She's just set up a new outfit called the Right Studio. Olu Jensen, who does a lot of work with trans youth in the UK and is going to be talking about that. And Nabil Peterson, who runs Interfer, which is a participatory creative outfit based in Cape Town. And all of them use creative praxis in their work. And that is what we are going to be talking about next. Also, for those of you who don't know Rejuvenate well, just to say that our living archive is very central to our method. And we see it as a kind of a springboard and a focus point for our work. And what IDS offers in many ways is its convening power, and we want to take advantage of that. And what Rejuvenate, I guess, now offers as well, and that's not just at IDS, it's also at the University of Highlands and Islands. And please use us. If you have blog ideas, we actually have a budget for this. We would really value inputs from people. Use us to highlight your projects. We see ourselves as a field resource, and we want the archive to be something that lives and breathes and that is kind of connected to all of you. Yeah, and if you have anything to contribute in terms of projects, in terms of people, in terms of reports, send them to us and we will make a noise about them for you.
No, thanks. There are some people putting things into the chat as well. I think Alex from Sierra Leone, thank you. Yes, do please contribute your projects and your thoughts. And we will certainly follow up with people of input. But thanks, and do tell people about the next dialogues as well. But thanks for coming, and it's really good to connect. Sometime we will meet, not on a screen, but at the moment it's very nice to see you on screen. Namaste, thank you very much.